The pros and cons of liposuction in 2021. Hello lovely YouTube family, welcome back to Healthy Drops. Today we're going to talk about the pros and cons of liposuction in 2021. You really don't want to miss this one. Liposuction, called lipoplasty, liposculpture suction, liposectomy or lipo, is a type of cosmetic surgery that breaks up and sucks fat from the body. It is often used in the abdomen, thighs, buttocks, neck, chin, upper and back of the arms, calves, and back. The fat is removed through a hollow instrument known as a cannula. This is inserted under the skin. A powerful high-pressure vacuum is applied to the cannula. Liposuction is the most common cosmetic operation in the United States, and more than 300,000 procedures are carried out in the United States each year, with costs ranging from roughly $2,000 to $3,500. People who undergo liposuction usually have a stable body weight but would like to remove undesirable deposits of body fat in specific parts of the body. Liposuction is not an overall weight loss method. It is not a treatment for obesity. The procedure does not remove cellulite, dimples, or stretch marks. The aim is aesthetic. It suits those who wish to change and enhance the contour of their body. Liposuction permanently removes fat cells, altering the shape of the body. However, if the patient does not lead a healthy lifestyle after the operation, there is a risk that the remaining fat cells will grow bigger. The amount of fat can be safely removed is limited. There are some risks, including infection, numbness, and scarring. If too much fat is removed, there may be lumpiness or dents in the skin. The surgical risks appear to be linked to the amount of fat removed. Uses. Liposuction is mainly used to improve appearance rather than providing any physical health benefits. Most people would probably achieve the same or better results by adopting a healthful lifestyle with a balanced diet, regular exercise, and a healthy sleep schedule. Liposuction is normally advised only if lifestyle changes have not achieved the desired results. It can treat areas of fat that are resistant to exercise and diet. When an individual gains weight, each fat cell increases in size and volume. Liposuction reduces the number of fat cells in isolated areas. People should discuss the pros and cons of liposuction with their doctor before deciding on whether to proceed. Liposuction should only be carried out after careful consideration. Results are subtle rather than dramatic. The following body areas are commonly targeted for liposuction treatment: abdomen, back, buttocks, chest, inner knees, hips, flanks, love handles, neckline and the area under the chin, thighs, both saddlebags or outer thighs and inner thighs, upper arms. Liposuction works best for people with good skin tone and elasticity, where the skin molds itself into new contours. People whose skin lacks elasticity may end up with losing-looking skin in areas where the procedure was done. The person needs to be over 18 years of age and in good health. Those with circulation or blood flow problems such as coronary artery disease, diabetes, or a weakened immune system should not undergo liposuction. Benefits. Liposuction is normally done for cosmetic purposes, but it is sometimes used to treat certain conditions. These include lymphedema, a chronic or long-term condition in which excess fluid known as lymph collects in tissues, causing edema or swelling. The edema commonly occurs in the arms or legs. Liposuction is sometimes used to reduce swelling, discomfort, and pain. Gynecomastia. Sometimes fat accumulates under a man's breasts. Lipodystrophy syndrome. Fat accumulates in one part of the body and is lost in another. Liposuction can improve the patient's appearance by providing a more natural-looking body fat distribution. Extreme weight loss after obesity. A person with morbid obesity who loses at least 40% of their BMI may need treatment to remove excess skin and other abnormalities. Lipomas. These are benign fatty tumors. Risks. Any major surgery carries a risk of bleeding, infection, and an adverse reaction to anesthesia. The risk of complications is usually associated with how large the procedure is, as well as the surgeon's skills and specific training. The following risks, unpleasant side effects, or complications are possible. Severe bruising. This can last for several weeks. Inflammation. The swelling may take up to 6 months to settle and fluid may continue to ooze from the incisions. Thrombophlebitis. A blood clot forms in a vein causing inflammation and further complications. Contour irregularities. If there is this poor skin elasticity, if the wound heals in an unusual way, or if fat removal has been uneven, the skin may appear withered, wavy, or bumpy. Numbness. The affected area may feel numb for a while this is usually temporary. Infections. Rarely, a skin infection may occur after liposuction surgery. Sometimes this needs to be treated surgically, with the risk of scarring. Internal organ punctures. This is very rare. Death. Anesthesia involves a small risk of death. Kidney or heart problems. As fluids are being injected or suctioned, the change in the body's fluid levels may cause kidney or heart problems. Pulmonary embolism. Fat gets into the blood vessels and travels to the lungs, blocking the circulation in the lungs. This can be life-threatening. Pulmonary edema. Sometimes when fluid is injected into the body, it accumulates in the lungs. Allergic reaction. The patients may be allergic to medications or materials used during surgery. Skin burns. The cannula movement may cause friction burns to the skin or nerves. Those who are most satisfied with the results tend to be the people who carefully consider the pros and cons beforehand, who are informed about what to expect, or who choose a qualified and experienced surgeon and to discuss the details carefully with their surgeon. This brings us to the end of our video. I hope you enjoyed it. Hit like if you did, and don't forget to subscribe to our channel so that you don't miss out any of our videos in the future.